Hi, my name is Chloe Crawford and I'm in the Pre-Respiratory Care program. To learn more about my future career, I've been reading articles from the American Association of Respiratory Care website. According to AARC, respiratory therapists are essential to the healthcare workforce. Breathing is one of the most vital functions of the body, and respiratory therapists are there to make sure you're breathing properly. Respiratory therapists need to be knowledgeable on skills that help diagnose respiratory illnesses. Knowing the proper way to listen to lung sounds, what the lung sounds mean, and the importance of respiratory diagnosis is essential for RTs to help patients feel well again. Before you listen to lung sounds, you need to know what you're listening for. There are 4 types of lung sounds: rales, rhonchi, wheezing, and stridor. Rales is also known as crackles. It is a low or high-pitched crackling that is heard in the lungs. This is caused by the opening of small airways. Rhonchi is a continuous low-pitched rattling which can be compared to snoring. This is caused by an obstruction or excess fluid in the airways. Stridor is a high-pitched sound that's heard when you breathe in. This is caused by a blockage or a trauma caused to the airway. Wheezing is a high-pitched whistling sound when you exhale. It occurs in narrowed airways. It is important to listen for all of these sounds so you get the proper diagnosis, and it is important to listen carefully so you know what you're listening for. Now I'm going to show you how to listen for lung sounds. What you're going to want to do is put the earpieces in, and you're going to be using the bigger part of the diaphragm, which is here. And just to make sure that you're in it, just listen by tapping. Okay? So you're going to want to start right side, a little underneath the clavicle. And then you're going to want to ask your patient to breathe in at each position. Okay, and then whatever you do over here, you're going to want to make sure you listen to the left side so you get the left lung as well. And then you want to go a little bit lower, but you're still in the upper chest. That way you're listening to the upper lobes, and you're also getting some heart rhythms. And then finally, for this side, you want to go to the lower part of the chest so you can get the lower lobes. And it is important to listen carefully. And if you're not sure what you heard, you can always ask them to breathe again. Now when you're finished with the front side, you're going to repeat with the back, starting from the top and working your way down. This is one of the first forms of diagnosis because it is non-invasive, because you're listening to the outside of the body, and it's also inexpensive because the only material you need is your stethoscope. According to the U.S. National Library of Medicine, it is important to distinguish normal respiratory sounds from abnormal to make a correct diagnosis. It is important to catch respiratory diseases early so you can get the best form of care and increase the quality of life for the patient. In the Global Impact of Respiratory Illnesses published by the World Health Organization, 4 million people die prematurely each year from chronic respiratory illnesses. Using the simple auscultation, or listening to lung sounds, can help diagnose COPD, asthma, and tuberculosis, along with many other lung diseases. Since there is an abundance of respiratory illnesses, especially right now, respiratory therapists are essential to healthcare, and knowing the skill of listening to lung sounds using a stethoscope is essential to getting the right respiratory diagnosis. Thank you for your time.